Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Viral gastroenteritis. Introduction. Gastroenteritis is an inflammation of the lining of the stomach, small intestine, and large intestine. It is often mistakenly referred to as the stomach flu. Gastroenteritis is most often caused by a virus. It spreads through contaminated food or water and contact with an infected person. This program focuses on the causes, prevention, and treatment of viral gastroenteritis. Gastroenteritis symptoms. The main symptoms of viral gastroenteritis are watery diarrhea, vomiting. Other symptoms include abdominal pain, chills, fever, headache. Symptoms usually appear within 12 to 48 hours after exposure to a gastroenteritis-causing virus and last for 1 to 3 days. Some viruses cause symptoms that last longer. How viral gastroenteritis spreads. Viral gastroenteritis is often called the stomach flu. However, it is not caused by the influenza viruses. The viruses that cause gastroenteritis are transmitted from person to person. Viruses are present in the stool and vomit of people who are infected. Infected people may contaminate surfaces, objects, food, and drinks with viruses, especially if they do not wash their hands thoroughly after using the bathroom. When an infected person with unwashed hands shakes hands with or touches another person, the virus can spread. When an infected person vomits, the virus can become airborne. People may be infected with viruses by eating foods that are contaminated with the virus, such as oysters from contaminated waters, sharing food, drink, or eating utensils with infected people, swallowing airborne particles that contain viruses, touching contaminated surfaces or objects and then touching their mouths. Some viruses can survive for months on surfaces that are not thoroughly disinfected with a bleach solution. Hard surfaces should be cleaned with a mixture of 2 cups of bleach and 1 gallon of water. Infected people who do not have symptoms can still transmit viruses. Viruses may be present in the stool up to 2 weeks after a person recovers from gastroenteritis. Outbreaks of viral gastroenteritis can happen in households, childcare settings, schools, nursing homes, cruise ships, camps, dormitories, restaurants, and other places where people gather in groups.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Complications. Dehydration is the most common complication of viral gastroenteritis. When someone does not drink enough fluids to replace those that are lost through vomiting and diarrhea, dehydration can result. When dehydrated, the body does not have enough fluids to keep the proper balance of important salts or minerals, known as electrolytes. Infants, young children, older adults, and people with weak immune systems have the greatest risk of becoming dehydrated. The signs of dehydration in adults are dark-colored urine, dry skin, excessive thirst, infrequent urination, lethargy, dizziness, or faintness. Signs of dehydration in babies and young children are dry mouth and tongue, high fever, lack of tears when crying, no wet diapers for 3 hours or more, sunken eyes, cheeks, or soft spot in the skull, unusually cranky or drowsy behavior. Also, when people are dehydrated, their skin does not flatten back to normal right away after being gently pinched and released. Talk with a healthcare provider if you have or your child has blood in the stool, which may indicate a bacterial infection, symptoms that are severe or last more than a few days, symptoms of dehydration, Severe dehydration may require fluids to be given into a vein. Sometimes a stay in a medical facility is needed. Untreated severe dehydration can cause serious health problems such as organ damage, shock, or coma. Treatment. Most cases of viral gastroenteritis resolve over time without specific treatment. Antibiotics are not effective against viral infections. The main goal of treatment is to reduce symptoms and prevent complications. Over-the-counter medicines can help relieve symptoms in adults. These medicines are not recommended for children. Talk to your healthcare provider to learn about over-the-counter treatments. The following steps may help relieve the symptoms of viral gastroenteritis in adults. Get plenty of rest. Drink plenty of liquids to replace fluids and electrolytes. Fluids include fruit juices, sports drinks, caffeine-free soft drinks, and broths. Avoid fatty foods, sugary foods, dairy products, caffeine, and alcohol until recovery is complete. Sip small amounts of clear liquids or suck on ice chips if vomiting is still a problem. Gradually reintroduce food, starting with bland, easy-to-digest foods. Some examples include rice, potatoes, toast or bread, cereal, lean meat, applesauce, and bananas. Because of their smaller body size, infants and children are likely to become dehydrated more quickly from diarrhea and vomiting. To help relieve symptoms of viral gastroenteritis and prevent dehydration in children, give rehydration drinks recommended by a healthcare provider. Food as soon as the child is hungry. For infants, give breast milk or full-strength formula as usual along with oral rehydration solutions. Older adults and adults with weak immune systems should also drink rehydration drinks to prevent dehydration. When to call your healthcare provider. Gastroenteritis usually goes away without treatment. Diarrhea and vomiting are not usually harmful, but they may signal a more serious problem. Contact a healthcare provider if you have any of the following symptoms. Diarrhea lasting for more than 2 days in adults or 24 hours in children. Signs of dehydration including thirst, headache, dry skin, or dizziness. A fever of 102 degrees Fahrenheit or higher. Severe pain in the abdomen or rectum. Stools containing blood or pus. Stools that are black and tarry. If children have diarrhea, parents or caregivers should immediately call a healthcare provider for advice. Diarrhea is especially dangerous in newborns and infants. It can lead to severe dehydration in just a day or two. Children can die from dehydration within a day. Prevention. People can reduce their chances of getting or spreading viral gastroenteritis. The following discusses some ways to prevent a gastroenteritis infection. Wash your hands with soap and warm water for 20 seconds after using the bathroom or changing diapers. It is also important to always wash your hands before eating or handling food. Disinfect contaminated surfaces. Surfaces such as countertops and baby changing tables are areas that need special attention. Wash all surfaces with a mixture of 2 cups of household bleach and 1 gallon of water. Avoid foods and drinks that might be contaminated. This includes sharing food with people who may have gastroenteritis. Vaccination can help protect a person from some of the viruses that can cause gastroenteritis. All vaccines carry the risk of side effects. Parents of infants should discuss vaccination with a healthcare provider.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Gastroenteritis is the inflammation of the lining of the stomach, small intestine, and large intestine. Several different viruses can cause viral gastroenteritis, which is highly contagious and extremely common. Viral gastroenteritis is transmitted from person to person. The main symptoms of viral gastroenteritis are watery diarrhea and vomiting. Dehydration is the most common complication of viral gastroenteritis. Dehydration is caused by not drinking enough fluids to replace those that are lost through vomiting and diarrhea. Antibiotics are not effective against viral infections. the primary goal of treatment is to reduce symptoms. Most cases of viral gastroenteritis resolve over time without specific treatment. You can reduce your chances of getting or spreading viral gastroenteritis. Wash your hands thoroughly with soap and warm water for 20 seconds after using the bathroom or changing diapers and before eating or handling food. Disinfect contaminated surfaces and avoid foods or liquids that might be contaminated.
Thank you for using Explain.